Good afternoon, members of the Texas Health and Human Services Commission and Medicaid Managed Care Leadership. My name is Marcia Sawyer. I am presenting a structural reform with Texas Medicaid Managed Care contracts, the adoption of a standardized health literacy communication requirement. Access to care alone does not ensure stability. When patients and caregivers do not fully understand discharge instruction, medication dosing, or follow up instructions, preventable utilization becomes built into a system operation. Clear communication is not simply a clinical courtesy, it's an essential delivery infrastructure. Texas Medicaid currently serves more than 3.8 million beneficiaries according to Centers for Medicaid and Medicare Services enrollment data. Texas Health and Human Services Commission reports approximately 1.58 million emergency room department visits each year that are considered potentially preventable. At this scale, every modest improvements has measurable fiscal impact. A 5% reduction in preventable emergency visits would avert nearly 79,000 encounters annually. At estimated $1,200 per visit, this represents roughly 94 million in avoidable expenditures. Recent peer reviewed research and federal quality reports consistently show that limited health literacy is associated with increased hospitalization, poor chronic disease control, and higher emergency department utilization. When patients do not fully understand Medicaid instruction, adherence declines and preventable utilization rises. Despite the evidence, structured communication practices are not consistently integrated into Texas Medicaid managed care contracts. Communication quality therefore varies across plans and providers. In a program of this size, that variability becomes systemic. Family members and caregivers frequently manage medications, follow up appointments, and treatment plans for children, older adults, and individuals living with chronic illness. Contemporary research on family health system demonstrate that caregiver involvement significantly improves adherence and long-term outcomes. When caregivers are excluded from structured communication processes, predictable system inefficiencies follow. Texas Medicaid measures outcome, but it does not consistently standardize one of the primary driven drivers of those outcomes, patient comprehension. This is a government design gap. Texas Medicaid managed care contracts embedded a standardized health literacy communication requirement without provider participation and quality oversight structures. The standards includes four core practices: the consistent use of plain language, structured use of the teach back method during key care transitions, documentation of comprehension, confirmation within existing electronic health record workflows, and caregiver inclusive communication protocols in pediatric and chronic disease care. This teach back method is widely recognized in the clinical quality research as an effective strategy for confirming patient understanding. The Agency of Health Research and Quality provides implementing guidance through its Health Literacy Universal Precaution Toolkit, and the Centers for Medicare and Medicaid Services already evaluate communication and clarify through CAHPS quality measures. The infrastructure and precedent already exists. Importantly, the reform does not expand Medicaid eligibility or create a new benefit category. It operates within existing contract, authority, and quality monitoring system administered by the Texas Health and Human Services Commission. Implementing follows three phases: contract alignment, guidance, issuance, integration into provider and onboarding and workflow prompts, and ongoing compliance monitoring within existing performance review processes. Because this reform standardized communication practices rather than expand services, administrative impact remains limited while improving system efficiency. Efficiency. Two concerns are commonly raised. The first is cost. However, this reform does not introduce new reimbursable services. Even modest reduction in preventable emergency utilization generates substantial fiscal return at Medicaid scale, allowing efficiency gains to offset implementation cost. Implementation cost. The second concern is provider burden. Some argue that structured teach back slows clinical workflow. Evidence suggests the opposite long term effect. Confirming understanding during care encounters prevents repeat visits, readmissions, and downstream acute care utilization. Clear communication reduces cumulative system burden. Texas Medicaid operates at an extraordinary scale. When communication practices remain discretionary, variability becomes embedded in system design, producing avoidable inefficiency. Embedding standardized health literacy communication requirements within managed care contracts strengthens chronic disease management, improves adherence, and supports caregiver engagement and reduce preventable utilization without expanding benefits or eligibility. Clear communication improves adherence. Improved adherence reduces avoidable utilization. Reduced utilization strengthens system of efficiency. This reforms aligns with federal quality frameworks, contemporary peer-reviewed evidence, and Texas Medicaid responsibility for fiscal stewardship. Texas Medicaid treats health literacy as delivered infrastructure, not as professional discretion. Thank you.